Welcome to the latest episode of the Dr. Tom Show. Thanks for joining me today. I know it's been a little while, but I'm going to continue bringing you episodes whenever I can. This week, I've taken some advice from my kids and kept the show a little bit loose. I'm also here to tell you how to be happy that your kids didn't go into the dental profession, as well as share some of my insights and experiences from over 31 years in private practice to help you have a better practice and maybe share the advice with your kids if they're going to become dentists. If you have advice that you'd like to share with me, please reach out to me through my website at drtom.show. That's drtom.show. Now, let's get started. Welcome to the show. Graduation season has come and gone, and it certainly gives me pause to reflect on my time when I graduated from college and from dental school and made that transition from the simple, predictable world of a student into the real world of a working person. I think even more recently to when my kids graduated from college and from grad school, as they made that transition, and wondered often how they felt about that, knowing that none of them chose to become a dentist. And I'm okay with that. In fact, I'm happy about that because it means that they found things that turned them on. They found things that they're passionate about. And they didn't go into the quote unquote family business just because mom and dad are both dentists. I often think, though, their perspective on dentistry was different than mine growing up. I chose dentistry because my experiences as a child going to the dentist and the orthodontist were always very positive. My dentist and my orthodontist seemed like they were pretty happy and relaxed and had a good life, and they had time off and made a pretty good living. They got to work with their hands and see different people, and they didn't have a boring office job. They were up and moving around and solving problems, and all of those things were attractive to me. Dentistry was a nice mix of some art, lots of science, a little bit of math, all things that I enjoy. And while my kids are all STEM superstars, they didn't choose that path because, in part, I also showed them the elements of dentistry that maybe aren't so glamorous and attractive. When they were young, I would bring them into the office to do those less glamorous chores on the weekends. We would clean the floors. We would shred old paper charts back in the day when they had been converted to digital charts. They even at one time vacuumed the ceilings. It's a long story, but one that they frequently like to retell. At the end of the day, though, in spite of those things, if they really, really wanted to be dentists, then they would be. That's the thing about this profession, and many others for that matter. For the time and the money it takes to get there, you have to have a very strong drive to achieve it. Otherwise, you could be very disappointed. And particularly when it comes to dentistry, it can be a fairly limiting degree. You're going to spend 4 years in dental school, $400,000 to $500,000 in tuition. And when you get out at the other side, the main thing you can do is practice dentistry. Yeah, you might argue that, I could go into teaching or I could go into research, things of that nature. Yes, that's true, but if you come out of business school with an MBA or you come out of law school with a law degree, there are still many pathways you can take that degree on. When you come out of dental school, it's a fairly narrow path to have that degree make sense. So I'm perfectly happy that my kids didn't choose that. But what I want to do with this particular episode and future episodes of the podcast from time to time is I want to share my over 31 years of full-time practice at this point with the audience. so that somebody else's son or daughter that may be getting into dentistry, or somebody that's recently graduated, or maybe in the early years of your career, can have some insights from, an old dog like me that's been through lots of different experiences and has lots of strong opinions on various topics, as you'll see. I think right now, just to put things in perspective, I think that dentistry is at a bit of a crossroads. And this is no different than any other time. Let me just start by saying that. So when I graduated from dental school in 1995, they also thought they were at a crossroads. The prior golden era of dentistry was in the mid 80s. All these people went through dental school and they got out, and literally all they had to do was put their name on a door somewhere, and they were instantly busy and everything was great. And during my era, those early years, there was lots of pessimism. There had been 5 or 6 dental schools that had to close their doors because there weren't enough people enrolling in dental school. There was this belief that there was a glut of dentists and this competition that maybe not everybody would do as well as they thought they would. And so it was a bit of a trough, if you will, for the dental profession. And now, in the 31 years since I graduated, there are more dental schools than there were then by quite a few. There is a tremendous amount of competition to get into dental school to begin with, and everybody wants to be a dentist all over again. So the crossroads in our profession at this point in time that I'm referring to is what I'll call employee versus owner. So the employee model means that you're going to go and work for one of these large organizations. They're commonly referred to as corporate dentistry. They're DSOs, IDSOs, they're partnerships. I mean, there's all sorts of acronyms out there. The bottom line is this: the structure of these places, where I would call it the employee model, is that you have a large organization with multiple dentists, multiple locations. And while you may be called a partial owner, you are certainly not the sole owner by any stretch. You are not the single decision maker as you would be in private practice. And this has become a very attractive and very popular path. Probably a third of the profession is going down this road. The other pathway that exists is what's always existed, which we commonly will refer to as private practice. That's one or more dentists, most often in a single location, but sometimes a small number of locations. And there is a very small group, if not a single dentist, that is the decision maker. The challenges with the private practice model, the old-time model that has existed since the beginning of time, is that in this day and age, it becomes more and more difficult to run a business with such a small footprint due to regulation, costs for equipment, technology, and so on. But these are two viable paths still to this day. And I would say starting in the employee model or the employee path is often a good option for a new dentist, because it's an opportunity to gain some experience, to be in a busy environment, to have some mentorship in some cases, not always, but some mentorship. And it also gives you a chance that should you choose to be an owner one day, you start to gain a sense for how you would want to run your own business. What things would you do the same and what things would you do differently? The other thing I would always encourage somebody that's going to be a brand new grad is to consider a residency. So if you're going into general dentistry, that would be a GPR or an AEGD. These residency programs are a terrific opportunity to continue your education in a more educationally focused environment than working in a corporate practice might be. The GPR and AEGD programs will have specialist attendings. They'll have specific curriculum in a sense, so a little more like a 5th year of dental school than a first year in the real world. So I always encourage people to consider that. However, some will choose to go into the corporate dentistry world, it's attractive. There's going to be a predictable salary. Typically, they're getting out into the world, working with other young dentists and having some freedom in terms of lifestyle on the evenings and weekends. Whatever role you choose, it's got to be the right fit for you. I will caution you, though, that the corporate pathway is riddled with burnout. There are many young dentists that will last maybe 18 months or 2 years in this environment and find that the stress and the pressure to produce is just so great that they have to find another path. In other cases, a young dentist coming out of dental school might choose an associateship. So instead of working in that corporate environment, working in a small practice as a dentist with a more seasoned practice owner, this can still provide good mentorship and the right situation. However, the risk is the limited number of dentists that might be in that practice. Typically, it's going to be one or two. If they're not good mentors or don't take good care of you, then it can also be just as disappointing as a first step in your career. You know, if you choose to stay an employee long term, it's not always a bad thing. In many of these cases, there are opportunities for a type of ownership in the group. And so there is a pathway to advance, to, move ahead in your profession. But remember, at the end of the day, you're not going to make all of the rules. You're not going to choose always what you want to do or don't want to do, the days you want to work or don't want to work. Some of these things are just not going to be in your control. That also goes for hiring decisions. You may have members of the organization that are not great teammates, but you're not the one in charge of hiring and firing. And again, that's a double-edged sword. It's not always so great being in charge of that either. So these are things that you have to consider. So that, the burnout issue and the issues around ownership on the private side are both potential downsides. Nevertheless, you're a dentist, and so you've just got to find the best environment to practice in, because when you do, the profession is not only rewarding, it can be a lot of fun, and you can have a very long and productive career as a dentist. I mean, it's not unusual to see a dentist working well into their 60s. You hope that it's by choice and not by necessity, but you'll find cases of both. What I'd like to do now is move on to a few topics of my life in private practice, because other than doing a residency right out of school, I've been in private practice for my entire career. First as an associate, and then for the last 24 years as a practice owner with my wife, who, as I mentioned before, is also a dentist. So the first topic I want to talk about is answering your own phone. What do I mean by that? What I mean is that when you're in your dental practice and you're sitting in the back office, maybe between patients, and the phone is ringing, the team in the front office is often handling all of those calls. Once in a while, though, they may get busy checking patients in, checking patients out, and handling phone calls all at the same time. It's a very demanding job if you've ever spent any time in a front office. So now and again, when I hear that phone ring a second or a third time, and I know that they're tied up and not able to pick up that call, I'll answer the phone myself. Because the one thing that I hate as a consumer is calling a medical practice and getting voicemail in the middle of the day when I know the office is open and people are there. It happens. I mean, there are just sometimes too many calls to answer, and so the call will roll over to voicemail. But if I can prevent even one call from going into voicemail, I've done somebody a favor. Now, the first reaction you'll always get when you answer the phone as the owner of the practice is the patient will be caught a little off guard, and they'll say, "Oh, I thought Sally was going to answer the phone. I didn't realize you were closed today." And I'll quickly tell them, I'll say, no, Sally was, she was busy with helping a patient check out, or she's on the other line, and I didn't want your call to go to voicemail. I can't tell you how much people appreciate that. And one of the great challenges of picking up a phone call, is that you don't know what the call is going to be. Sometimes it's something very simple. Hey, I'm just calling to see what time my appointment was tomorrow. I think I wrote it down wrong. Or somebody is calling to make an appointment for treatment or for an emergency. And lastly, sometimes it's a new patient. And I can tell you, for a new patient, how impressive is it that they have an opportunity to talk to the dentist that owns the practice when they're calling to schedule their appointment. And you don't always have to take every call from start to finish. Sometimes it's a matter of just taking a great message and letting that person know when the appropriate team member can call them back. Sometimes it's getting the beginnings of the information and asking the person to hold briefly and letting your teammate finish that call. But when it comes particularly to the emergency patients or scheduling patients for treatment, who better to handle the call than the dentist themselves? Because oftentimes, through a little bit of dialogue and looking at the person's chart while we're on the phone, I can either make a referral directly to a specialist if that's appropriate for whatever their emergency is, or I can pick a time that's appropriate in my schedule to see them and take care of what's bothering them. The way that we answer the phone, answering the phone like this not only gives you an opportunity to help a patient out and save your front office from having to retrieve a voicemail and make a return call, it also just gives you insight into their job. And while we're on that topic, I would say, while you are the dentist and you are there to do the dentistry, because I can hear your voices saying, what are you doing answering the call? That is not your job in the practice. No, it's not my job in the practice, but I should know how to answer a call. I should be comfortable taking a call, scheduling an appointment. I should know how those things work in the front office so that I can have a meaningful conversation with my teammates about their jobs and about what their challenges are, and, sorting out things that may be going on in that part of the practice, because it's an area that you don't spend really any time in as a dentist, but you still need to know what's going on, even if you're not the one that enters every payment or sends every statement to every patient. The secondary benefit to taking a call is, can you really operate your software beyond just looking at a patient's chart? Can you schedule an appointment? Can you find an appointment opening? Do you know where to put the information of a new patient into the practice management system so that they can have a chart created in the software? These are all great skills for you to have. And I can't tell you how many times I've picked up that phone to take a call and have saved a tremendous amount of time by being the one to directly answer the patient's question, because there are enough instances where the patient's call would have been the front office team member taking a message, asking me the question, getting the answer, calling the person back to relay the answer. So it's just a great way not only to be in touch with what's going on up front, but to let your patients know you're not afraid to speak to them directly. The next topic I'm going to call the nobody's ever done that before topic. And this is a handful of items that are so simple, it's almost comical. But these are things that people have repeatedly over the years said to me, nobody's ever done that before. And remember, I'm practicing in a suburb of Phoenix, Arizona. Most of the people we see are from somewhere else. Many of them have had more than 2 or 3 dentists in their life. So when they say nobody's ever done that before, they've been around enough that you would think some of these things had happened for them. The first is one of the silliest things. It's sunglasses for patients' safety. So we all know that the minimum requirement would be all of your patients are wearing safety glasses. And I would be quick to add to that the glasses they wear day to day to read and see and drive are not safety glasses. The secondary reason for not using their own glasses is that, let's say, a little prophy paste splatters on their glasses, and when they're on their way out the office, they grab a tissue to wipe that smudge off their glasses, but it's coarse prophy paste, and now they've scratched their glasses. You've got an unhappy patient, and you probably owe somebody a pair of glasses. Now, some offices will use the same clear glasses that the assistants and hygienists will wear if they're not wearing loupes. And the clear safety glasses are fine for the patients to use, but using sunglasses has the added benefit of keeping the bright light from your operatory or your headlamp out of the patient's eyes. It makes for a more pleasant experience. It helps the patient get a little bit lost in the visit and not be so involved in everything that's going on right around their face. You can get these safety glasses just at a Home Depot. The sunglasses would be used by somebody doing landscaping, for example. So they have a wraparound lens that's going to protect the eyes. And so what I always train my team members to do is, or I do it myself when I lay the patient back to get them numb, I'll just tell them, I'm going to trade glasses with you. I'm going to give you these sunglasses to protect your eyes, and I don't want to get your glasses dirty. So I'm just giving the thing along with the benefit to the person. I'm not telling them I'm giving you these so you don't accuse me of scratching your glasses. I'm giving them those so that I can know their eyes are safe and protected while there's bits of old PFM crown flying through the air or amalgam, splashes of water. You get the idea. The next thing that I'd like to talk about is the intraoral camera. This is another thing that people are going to say, oh my God, I use the intraoral camera too. Well, a lot of us do. And for me, the intraoral camera is a pre-op and post-op photo of every tooth that I treat. But it's also used in every new patient exam. And this is where patients will comment on it the most. So whether the patient has a bunch of dental needs, so many things that are worth taking a photo of, cracked teeth, broken restorations, etc., or they have a fairly healthy mouth as a new patient, they have a few old restorations that are still in good shape, and very little treatment, if any, that needs to be treatment planned, I'm still taking photos. And what I'm taking photos of is their existing restorations, the calculus that is always there behind the lower front teeth, tori, just anything that might be unusual or out of the ordinary. And so in the case of that patient where there's really nothing to discuss from a treatment plan perspective, I might say, here's a picture of an old amalgam filling you have on the lower left. The filling is still in good shape, but now we have a photo of it. And if it should change down the road, we'll know, and we'll be able to let you know so we can replace it if necessary. This lets patients know that you, from the beginning, are very clued in to maintaining their oral health. That first visit, that new patient exam, is your opportunity to establish the baseline that they have. And from that point, you're hoping to either maintain them if they're in great shape, improve them if they're in bad shape. You certainly don't want to sit back and watch them decline. So having these reference photos gives you the opportunity to say, this is what your tooth looked like the day we met, and it either in the future still looks the same or it looks like something has changed. Patients just appreciate the education of saying, hey, I want to make you aware of these little bumps that are under your tongue. We call them tori. They're harmless. But if somebody hasn't told you that they're there, you should know they're there. Because about once a year, I get a patient that'll come in. They've just discovered their tori and they're in a panic that they have a tumor. We think that people are always aware of these things, but you'd be surprised. Sometimes they're not. So, in taking the time to not only go over the photos, but the other elements of the new patient exam, the comment will often be, I've never had an exam so thorough. The other element of the new patient exam is perio charting. So, again, this is not something new. This is something everybody's doing. But the question is how they're doing it. Oftentimes, I'll hear dentists run through the perio charting and get the x-rays, photos, and at the end of the appointment, they're sitting the patient up to tell them what they saw. And they'll say, oh, in your perio charting, we had, some abnormal measurements. But when they did the charting, they never told the patient what was normal and abnormal. So the patient didn't even hear what was going on. If I'm getting ready to do perio charting, I'll simply tell the patient, we're going to take some measurements in your gums so that we can get a baseline of what condition your gums are in. I'm going to call out a whole bunch of numbers. If you hear anything that's a 3 or less, that's normal. And then off we go. Once I've done that, the patient's brain is trained on listening for anything above the number 3. So by the time we've finished that perio charting, they know where they stand. They may not have a clinical definition of where they stand, but they have a sense. Again, it's just a matter of letting people know what you're doing and why. For the same reason, at the beginning of the dental charting, I'll let them know I'm going to call out a whole bunch of things here. And this is a lot of your existing fillings and crowns and so on, if that's appropriate. Because when you don't tell people that and you start saying 3 MO amalgam, 4 DO, 5, the patient's eyes immediately get big. Is that a cavity? Is that a cavity? And because their mind wants to go to, oh, this guy's going to find 100 cavities in my mouth. And that's not the case. You're letting them know we're getting the baseline of where you are today, and then we're going to figure out what needs to be done. Phone calls after anesthetic is another very often repeated recommendation. It's not often done. And the reason you know it's not often done is if you do it, you'll be surprised at how many of the people you call say, nobody ever did that for me before. That's how you know that it's something special. And as with all of these things, if you want to distinguish yourself, if you want to stand out to people, if you want to build trust, these are the things that you need to be doing. Otherwise, you're just like everything else. And that's part of the reason that, again, what we commonly refer to as corporate dentistry has grown such a foothold, is that the dental experience has become so generic that people are just going anywhere. When the experience is differentiated, people will choose one experience over another. Again, we know this in our own practice because over the years, we've dropped various insurance participation and found that many patients stayed, or patients that chose to leave for an office that was quote unquote in their network oftentimes came back because they said it wasn't the same as coming here. So having a good system of communication between the doctor and assistant is the next area where you can distinguish yourself. This is what I mean by that. My number one pet peeve is when the dentist walks into the operatory and says, "What brings you in today?" Now, that sounds like a normal question to ask, except remember that patient was brought to the operatory by the assistant. The assistant and that patient had a conversation about why they were there and what was going on. And now the dentist is going to walk in there and ask the patient to repeat their story. This happens all the time in medical offices. And to me, it's the most, it's just poor form. Let's put it that way. I don't want to say something too salty, but the best way to demonstrate that you're listening to somebody is to be able to repeat the story back to somebody else. So in our practice, the way that it works is, again, you're often entering an operatory from behind the patient. They don't see you coming, but the dental assistant knows that it's their responsibility to relay what they've learned from the patient. And what they will do when they seat the patient and have the conversation about whatever's going on, they'll tell the patient, okay, I'm going to get the doctor to come in now and take a look. I'll let him know what's going on with you. So that way, when I come in the room and say hello to the patient, hey, Joe, how you doing? Nice to see you. The assistant can immediately take over and say, oh, Dr. Tom, Joe is in today because X, Y, and Z happened. He's been having some pain, sensitivity, whatever the case might be. It's been going on for this long, on and on. So you get the whole rundown. Now, if they missed anything, or if Joe forgot to tell the assistant something, that'll be his opportunity to fill in any missing information without repeating his entire story. Now I automatically know what's going on, and I haven't really had to make Joe repeat himself. And as I'm setting him back to have a look, I can now ask him follow-up questions to fill in any blanks that there might be, rather than having him repeat the story over again, like we're testing him to see if he's being honest. It's kind of silly, but I hear it all the time. So please, don't be the person that walks in and says, hey, what's going on? What's up? Your dental assistant has an opportunity to show you what they've learned about the patient, not only about their dental condition, but maybe they were chit-chatting about a vacation or something else that's interesting. And this allows you to come in and pick up right with what's going on with that patient. In a similar way, when it comes to hygiene exams, I have the same approach. In particular, because in the case of a hygiene exam, the hygienist has had the benefit of spending the bulk of the appointment time with the patient. They're in their mouth, they're tooth to tooth to tooth. They're really having a close look, and hygienists are outstanding at making observations, of noticing things that are out of the ordinary. And while there's always this kind of running joke of like hygienists aren't allowed to diagnose something, which, is kind of silly to think of that as some kind of a crime, they are allowed to tell you what they see. And when we come in to do a hygiene exam, how great is it that the hygienist, when I come in, can introduce the patient and say, Dr. Tom, Mary is here today for her 6-month checkup. She was here 3 months ago for a filling on the upper right. That's feeling fine. We took new x-rays today, or we did perio charting today. I have a couple of areas I want you to look at. I wanted to show you something on the x-ray. Whatever the case might be, we can have a whole rundown. Again, Mary is there, the patient is there to hear that exchange. So Mary knows that while the hygienist has been there working away, she's been carefully observing areas of concern. She's been learning things about what's going on with Mary. She's heard any issues that need to be addressed, and she's relaying those to me. So again, Mary's not repeating herself, and Mary also realizes the hygienist is not doing this with their eyes closed. The hygienist is very much engaged in Mary's outcome. And I know that this is also in the category of nobody's ever done that before. And again, I know that that's an exaggeration. But I can tell you over the years, we have a number of hygienists in our practice. And there have been times when hygienists have been out, or we've had an opening for whatever reason, and we've had temps come into the office. And I can tell you virtually every one of them has exhibited no ability to deliver that kind of handoff. Now, you would think that this would be automatic, routine, and it's really not. And again, some of you are going to say, well, wait a minute, nobody told them how it's meant to be done. What I like to do, though, is give them an opportunity to show me how they like to work. And if they're not presenting the patient, if they're just standing there when I come in to do the exam and saying nothing about what's going on, I know that more than likely they're just there to collect a paycheck. As a temp, they have no buy-in in the continuing care of this person. They're just a mercenary doing a job. So I will usually pull them aside and kind of give them a little introduction to what my expectation is for presenting a patient, because I think it's the professional and right thing to do. And they also would have the opportunity at the beginning of the day to just say, how do you want me to present the patients when you come in to do the exam? And it's not as common a skill as it should be, because it should be an automatic. It shouldn't be something that you've got to draw out of the person. They should be ready to do that from the get-go. And in our practice, we use huddle slips, which summarize the patient's reason for a visit, last visit, etc. So all of that information is there. And that works for our own team who know these patients well, but it also is very beneficial to somebody that might be coming in as a temp and has no knowledge of the patient. We've filled out the huddle slip for them so that they have all the background information to be presented at the time of the exam. The last area I want to touch on is after hours emergencies. And in this topic, the first thing I'm going to say is that too many dentists are not available after hours. And before you drive your car off the road, let me just say, I'm not talking about that you're going into the practice routinely every weekend to do treatment. What I'm saying is you should be at least reachable by phone or email for a patient that has a question or an urgent need. And again, urgent is defined by what they think is urgent, not what we believe is urgent. That's to be sorted out when you get on the phone together. And so why can I say that too many dentists aren't available? I can say that because in the 24 years that I've had a practice of my own, and I've been available after hours, I've had a number of times where patients are calling me and they cannot get a hold of their dentist. And I'm not talking about they call me saying, I left a message on my dentist's emergency line and he didn't call me back. I'm saying they've called the dentist's office and there's no mechanism for leaving a message after hours or reaching someone after hours. And I think this is, it's unprofessional is probably the simplest way to say it. You need to be available in some way, shape, or form. It doesn't need to be instant, but there should be a way for people to leave a message. In our practice, the way that we do it is there's two options when you call. The voicemail says, press 3 to leave a message for a return call on Monday. Press 4 if you're experiencing a dental emergency and would like to leave a message for one of the dentists. That voicemail gets recorded, and then we receive an email and a text message to alert us that there's a new message available. This path I prefer. Some dentists will share their cell phone number with patients. I prefer this path because it gives me some flexibility in how and when I respond. So I can receive that message. I have an opportunity to log in to the practice management software to review the patient's chart, see what's going on relative to the chart based on the message they left, and also have a plan in mind when I call them back. For example, if I think it's something that I am going to need to go in for, before I've called them back, I can work out with whoever's going to come with me to the office what time would be best for us to go. In most cases, since my wife is a dentist as well, we'll usually go in together. On occasion, for longer stretches, holidays and things like that, we'll have our assistants each take a day to be available on call. So if it's a day like that, I might reach out to that assistant and say, I have a patient that it sounds like we might need to come in for. If we do need to come in, what time's good for you? Now we're scheduling the patient at a time that's convenient for my helper and for me. And then I can call the patient back, sort out what's going on. And if they do need to come in, I'm prepared to offer them a time to meet at the office and take care of whatever's going on. The way that I communicate with patients when I do call them back or text them is I use a Google Voice number. I like to use a separate number from my cell phone number so that should somebody take advantage of that access, I have a way to sort out incoming calls as to whether they're coming from patients or other people. Also with the Google Voice number, which just rings to my cell phone. It's just like having a second number you can call. Um, with the Google Voice number, patients, I can text them as well. So sometimes if I'm out and I'm somewhere where I can't call the person or I don't have an opportunity yet to look at their chart, I can send them a text message and say, hey, it's Dr. Tom. I got your message. I can't call right now, but I'll call you in about an hour. In the meantime, can you text me a picture of the broken tooth? Let's say that's the reason they called. So sometimes you'll have a parent's calling because Johnny fell and broke his front tooth, but we all know that there is a gradient of urgency relative to how much of the tooth broke off. So if you have the parent send you that photo, now you have a really good idea of exactly the level of emergency we're dealing with and can, again, respond accordingly. And oftentimes, a conversation on the phone is really all the person needs. Sometimes a person is calling, they have a concern or they have something that's bothering them, and they just want to know that you could see them on Monday morning. They just want to know, am I going to be okay for another day? And can I just come in and see you Monday? Can I get an appointment for Monday morning? So that gets back to what we talked about before. Your ability to just be able to schedule an appointment is certainly a basic skill everyone should have. And, oftentimes having that 10-minute conversation with a patient on the phone is really all they're looking for in terms of your availability. Patients are very reluctant to ask you or really ever insist that you come into the office. And the only real exceptions to that would be more true emergencies. Somebody fell on their face and avulsed 2 teeth. Things that really need more immediate care. And just to put a little point on that whole notion, I'll share a quick story. Our dog has had a chronic illness for many, many years. It's recently gotten a little bit worse, and we had to take him to a veterinary neurologist. And you thought dentistry was expensive. That's all I can say on that. The veterinary neurology appointment was on a Friday afternoon. They had to sedate him to do an MRI and a spinal tap, so it was a whole thing. When we left there on Friday, they said, we'll call you tomorrow, Saturday morning, just to check. So their aftercare call, good policy. The doctor's assistant called us on Saturday, and my wife let her know things were not good. The dog had not come out of the anesthesia as well as was expected. She said, okay, I'll relay this to the doctor and I'll call you back. She called back a few hours later. The doctor basically said, more or less, give it some time and we'll see from there. Now, this was a holiday weekend, so Monday, nobody was working. So we got through the weekend, Sunday, Monday. We just figured we'll wait and see how things do. And he did start to do a little bit better. But I really had thought the doctor would call me on Tuesday to say, hey, I got your message over the weekend. I know the assistant spoke to you. I just want to check in to see that things are doing better as we had expected they would. And I never got a call. And I got a little frustrated by that. I gave him the day because I didn't want to be a pest, but I did hope that they would reach out to check on our dog. So Thursday night, I left a message on their voicemail to say, please have the doctor, please give me a call when he comes in the morning. I'd like to talk to him. And that following morning, the Wednesday, his assistant called me again and said, hey, what's going on? And I just said to her, I said, I'm really hoping I could speak to the doctor because we have some ongoing concerns. And I let her know what those were. And he did call me back. And I let him know, kind of what my expectation was. And, it turns out he was not in the office on Tuesday. It was his day off. I think he was, on a maybe extended weekend. And I just let him know, I said, I wish that somebody had told me that because, when we left Friday, they could have done a better job saying, doctor's not going to be back till Wednesday. If you have a problem and you need to speak to a doctor, here's the number you should call. Because the assistant, we were only able to talk to her. If you called the office over the weekend, you couldn't talk to anybody. Nobody was answering the phone. She was just making outbound calls. So I shared that with him, and no sooner did I get off the phone after getting the update from him, and my assistant was putting a patient in the schedule for Monday because I was not in the office Thursday and Friday. And she said, this patient, he's frustrated. He's been to the endodontist for a root canal. He had an extraction at the oral surgeon. Both procedures were in the same area. He's having ongoing pain, and he's getting frustrated, and he wants to know what to do next. I mean, you couldn't have asked for better timing. I immediately went back to my office and called him up. And I can't tell you how much he appreciated that, because really all we needed to do was just talk through what had happened at the endodontist and what had happened at the oral surgeon. And I gave him my thoughts on why I thought he was having the issues he was having. And he really was just looking for a plan B. He said, it's Wednesday. I don't want to get to the weekend and still have a problem. And now I'm trying to figure out who I should call on the weekend, or maybe even having trouble getting a hold of them. So we worked out a plan, and it also gave me an opportunity. And I told him, I'm going to call the endodontist and let her know that if this doesn't resolve, I'm going to have you reach out to her. So this gave her the opportunity to know what was going on with this guy since he had been to her office, because it had been about 2 weeks. And that way, if he called, she'd be prepared for what she wants to do next relative to the tooth that she treated. So happy ending all the way around, but just a great example of how taking a few minutes on the phone can really do wonders for our patients. We don't always have to make them trudge into the office to sort something out. And certainly making somebody wait, in this case, this guy would have had to wait until the next Monday to see me, isn't ideal either. So I can't tell you how many times he thanked me in the short time we were on the phone, but I was happy to save him a trip, to save our schedule an unnecessary appointment, and to keep his care moving forward with the two specialists he was seeing. Well, that's all we have time for today. I want to thank you so much for tuning in. As I said at the front of the show, if you have comments or questions you want to share, please reach out to me through the website, drtom.show. That's drtom.show. Have a great day, everybody.